I'm an islander myself. I'm from Puerto Rico. When I came here, I see the parallels between Puerto Rico and Hawaii. I have a lot of pride of nursing, and I know that we had a lot of work to do. When COVID hit this island, it was so huge because it's only 200 beds and the hospital was packed. And it was incredible how we rallied. Our hospital was very ill prepared. That's when we felt the force of UNAC. The union that we had previously said they didn't know how to deal with Kaiser.
The very first day that we were over there, it was apparent the work was daunting. But fundamentally, the first piece we needed to take on was the trust of the members.
We weren't going to try to go in and make whatever UNAC UHCP looks like in California. Being able to be boots on the ground over there really helped me to learn more about the system, learn more about our members, and learn more about what direction we need to go in the future.
You use these approach that you know in nursing. I have a lot of practice by bedside, right? My name is Joel. I am your nurse today. The same thing. I'm Joel. I'm your union rep today. And here's the things that we can talk about. If you just listen to the members, you can almost come up with your immediate plan versus your long-term plan. I think we've done that here at Maui Health System.
You know, Maui is a tiny island with 147,000 people, and that hospital is a hospital for all the people. At any given time, your auntie, your brother is going to be here. Our first bargaining was very hard.
Unfortunately, right at the beginning of when we were supposed to go into bargaining, the pandemic hit.
At that time, we identified that the PPE supplies were not in place. Where Charmaine came in, she bring in information. This is how it's being addressed in Southern California so that upper management here can see. She was able to mitigate that.
Charmaine recognized that the communication between leadership and employers, it was from here to the moon. All of a sudden, there was emergency center, and then information started getting disseminated. And we did not have it until UNAC came in.
Our last bargaining, we were in negotiations for 6 months.
We were facing a very hard leadership. They really thought that they could give us whatever they wanted, and we will stay because this is just an island.
This was about equity for each and every one of you, raising the standards to be like the other workers that work at Kaiser Permanente across the street and on the islands. Why are you not getting the same thing?
UNAC had to help us get the media involved.
First at 4:30, nurses and other frontline healthcare staff at Maui Memorial Medical Center take to the streets tonight in their cars as they fight for a new contract.
They were offering us $0 as a raise. We felt that we needed the respect. This is our family. This is our community.
Because of that car parade, we got the hospital to come from offering us 0% to 2% and then now a wage reopener.
And that was the first time that Kaiser understood that this ohana, it's the community.
You know, here at Maui Health, we're wall to wall, so we cover the nurses, but we cover the pharmacists, the unit secretaries, truly almost the entire hospital.
One of the main things that I have seen about UNAC is their art of negotiation. I was talking to Charmaine. Charmaine, I wish you would taught me this when I was 18.
Charmaine's leadership here in Hawaii has been such an important and such like a key piece in all of the differences that we've been able to make. We were able to get the committee language in our contract, improved floating language into our contract, as well as improved wages for all of our members.
Significantly for the pharmacists here in Hawaii was that the salary bump. You know, when UNAC really worked hard to be able to get us to be more on par with the community.
Through the process of bargaining, it felt like we were able to, get some structure in place that would help to equalize things for therapists. There were discrepancies, between clinics in terms of like therapists' workload, how schedules were formed, how time off was decided, how therapists were compensated.
I just want to say thank you to all the members in California because it really meant a lot to us. knowing that you guys wouldn't sign your contracts until we were able to sign ours, and knowing that we mattered, it meant all the difference in the world. So thank you from the bottom of our hearts. Thank you.
I really felt like this group of our members, but just in general, the whole community has been through like one trial after another, and they're not alone now. They have not only their fellow colleagues and coworkers, but they have big bad UNAC UHCP behind them and to help them be able to get to the next level.